parents is why you should keep your children away from bath salts.
And next up on our program is Billy Jean and his show Drugs and You.
Good afternoon, everyone. My name is Billy Jean, and we're going to talk to you today about the peripheral nervous system. Today, I'll be interviewing Dr. Bob Robertson from his office at Brownie Bagshaw Hospital. Hello, Dr. Robertson.
Hey, Billy J. I'm excited to be here.
So what is the peripheral nervous system?
The peripheral nervous system, or PNS for short, connects the central nervous system to environmental stimuli to gather sensory input and create motor output. For example, if you were to touch something hot, like a stove, the signal would be sent through the PNS to the CNS, and then the CNS command would go back into the PNS, causing you to move your arm.
Wow, that seems complicated and sounds like a long process.
What actually happens very quickly? When dealing with the PNS, there tends to be two major categories of neurotransmitters, cholinergic and adrenergic. But today we're going to focus on adrenergic. Adrenergic is your sympathetic nervous system and has epinephrine and norepinephrine as its neurotransmitters.
So I know epinephrine and norepinephrine cause fight or flight, but why are they so important in this situation?
Exactly. It is important to note that these neurotransmitters receptors are affected by the drug to cause a reaction. One drug in this class is dopamine, which is agonist, meaning it promotes the function of the receptors.
Oh, I remember dopamine. It's what they use to help improve blood flow in shock victims.
Are you sure you're not a doctor? That's correct, and it can also reduce symptoms of heart failure. It activates beta receptors in the heart, improving blood flow in tissues.
Are there any adverse effects to this drug?
The most common adverse effects are tachycardia, dysrhythmia, and angina pain.
Increased heart rate, unusual heart rhythm, and chest pain do sound pretty terrible.
That's nothing compared to metoprolol, which is an antagonist, meaning it inhibits the function of the receptors. This drug is an inhibitor to beta receptors in the heart, and it is lipid soluble and passes through the liver. It reduces heart rate, and its main therapeutic use is for hypertension. Adverse effects are bradycardia, AV heart block, cardiac excitation and withdrawal, and reduced cardiac output.
Wow, decreased heart rate, complications with electrical signaling between the atria and ventricle does sound worse. Are those the only drugs that deal with adrenergic categories?
No way, Jose. I didn't even get a chance to talk about isoproternol, dobutamine, ephedrine, doxazosin, silodosin, and tamsulosin. These aren't even all of them.
Well, our producers are saying we are out of time. Thank you, Dr. Bob Robertson, for your cooperation.
No problem, Billy J. Thanks for having me.
Coming up, what could be hiding in your drain? Find out after a message from our sponsors.